So when a patient first shows up to the clinic, the first thing I want to know is, why are they having difficulty? Most patients that are coming in are having fertility issues, although not everyone is. The answer usually is we don't know initially because we have to do an evaluation.
What we do at the initial visit and kind of subsequent follow-up visits is actually test each part of that system. And that's going to include testing the ovarian reserve, so seeing how well the ovaries work. We also want to test the fallopian tubes to see if they're open. Lastly, we want to check the uterine cavity, and of course a semen analysis. Let's not forget that as well, it's a very, very important part of fertility too. So usually what I'll do is I'll do all of these tests. We'll come back, talk about all the tests together, and then decide kind of where to go with treatment. The majority of the testing is really non-invasive, pretty minor, pretty simple. So there are two main categories of treatment. And within each category, these categories are pretty broad. Within each category, there are multiple different types of treatments that can be done. But the major differences between them is whether or not the treatment takes place sort of inside or outside the woman's body. One category is called ovulation induction. The other category is called in vitro fertilization, or IVF. Ovulation induction consists of medical treatments which stimulate a woman's ovaries. Within that category, IUI, or intrauterine insemination, is also included. That's a simple procedure where we can take the sperm, concentrate it, and put it directly into the uterus. And that can be done with a partner sperm, or of course that can be done with donor sperm as well. The next category of treatment is IVF, in vitro fertilization. In that procedure, we give medication to stimulate the ovaries. We mature a few eggs, and then we remove those eggs from the body. We fertilize those eggs outside the body in a dish, and then we later on place an embryo into the patient's uterus. So the majority of the fertilization and those initial steps occur outside the body versus the initial category where it all sort of occurs inside the woman's body. The procedures in general are not very painful.
For what we do, there is some discomfort for patients when we're doing IVF, for instance, when we're getting the eggs, but that's a procedure where we give patients anesthesia. For the other procedures that we do, it's really kind of like a pap smear for patients. It's a speculum exam, it's a vaginal ultrasound. Patients are getting blood draws. So yeah, there's a little bit of discomfort with things that we do, but everything's very tolerable. So age is a significant factor for fertility. Women made all the eggs way before they were born and lost most of them before they were born. When they go through puberty, they've already lost 80% of their eggs. And the age of the egg coincides with the age of the female. So a 20-year-old egg is much healthier and viable than a 40-year-old egg. And so when we look at fertility rates, pregnancy rates really decline for women as they age, much more than for men because of the aging egg issue.
The timeline of treatment, starting treatment to pregnancy, really differs from patient to patient. And that's why we call it a fertility journey. The length of time of the journey really depends on the ovarian function of the woman, as well as other complicating factors that are involved.
Depending on what the diagnosis is, we might be able to start treatment right away. Sometimes it takes a few months to get all the evaluation done and then start treatment. And then depending on the type of treatment, patients might be able to get pregnant within 1 month. Some patients, if it's a little bit more severe issue, they might take several months. Unfortunately, there are some patients that don't have success and aren't getting pregnant with conventional means, and ultimately we then maybe have to talk about other ways of having a family, like using donor egg or using donor embryos or even adoption for patients. We're very lucky here in Hawaii that we're one of just a few states that has a mandate that covers IVF. And so for patients who have a Hawaii-based insurance, they typically get an IVF cycle covered at about 80 to 90% of the cost, depending on what their insurance coverage is.